so this is our safety analysis project. Our group members are Jackie, Jen, Andrea, and Lauren. Okay, so what the problem is, we've noticed that nurses are often pulling medications for multiple patients at the same time out of the Pyxis. They also sometimes access the Pyxis prior to 1 hour from when the meds are due, so they have to hold on to the medications until it's time to give them. And also there's a lack of education to more experienced nurses about the importance of only pulling one patient's medication at a time and pulling it within the time that it's due. So some of the other related problems to our main problems are that nurses, when they pull medications for multiple patients, they put them in bags and put them all in their pocket, so it's easy to get the meds mixed up for patients. Also, sometimes medications are left unattended, like in a patient room on the counter if they have a bunch of bags in their pockets, or also left unattended at the nurse's station. And so this gives patients or family the opportunity to possibly take meds that aren't theirs, which isn't safe for them.
So some current evidence that we found for this problem is that nurses are primarily involved in the administration of medications in all healthcare settings, and that is the fourth step of the medication process. In over 126 nursing administration errors, the majority were associated with wrong dose, wrong technique, and wrong drug. Another statistic is that the most frequent types of medication errors were wrong time, wrong dose, and wrong drug, and the three most frequent near misses were wrong drug, wrong dose, and wrong patient. The most extensive observation study, which was conducted in 36 different healthcare facilities in 2 different states, showed that of the 3,216 doses observed, 605, which is 19%, contain at least one error, and nearly half of those errors were wrong time errors. Some standards of practice, according to Sacred Heart, are the rights of medication administration include the right patient, right drug, right time, right route, and right dose. These rights are critical for all nurses and medical professionals. These essential environmental conditions conducive to safe medication practices include the right to complete and clearly written orders that clearly specify the drug, dose, route, and frequency, the right to have the correct drug route and dose dispensed from the pharmacies, the right to have access to all drug information, the right to have policies on safe medication administration, and the right to administer medication safely and identify any problems in the system, and lastly, the right to stop, think, and be vigilant about administration medications.
Providence has a lot of policies put in place for medication administration, but we thought that these ones were the ones that pertain most to the problem that we are discussing. And in summary, what these policies say is that from the Pyxis to the patient room, that period of transport needs to be a short amount of time. If the medication is a non-controlled substance, then it can be stored and locked in the patient room until administration. But if it's a controlled substance and the patient is not going to use it right away, it needs to be stored back into the Pyxis. Another thing is multi-dose vials can be stored in the patient room for a long period of time, but other medications should be brought back into the Pyxis. A knowledge gap is that nurses may not be aware of how often medication errors actually occur. Another thing is experienced nurses have been in a routine for so long that sometimes they forget new policies that are put in place to prevent medication errors, so they need to be reminded of that. And then another thing is that nurses need to be educated on preventable medication errors and how they can prevent those. And by doing continuing education, nurses will be able to prevent medication errors and provide patient safety.
So our first solution to our perceived problem is that continuing education for nurses on proper medication administration and patient safety as it applies to the medication process is really important and will greatly help nurses understand why it's important to follow the policies. Continuing education is important for nurses because evidence-based practice changes frequently, as well as policies of the healthcare center that they work at, and this new information is not always provided properly to the floor nurses. In an article that we found, a direct quote from Leibner is that a gap exists in the knowledge base of nurses in practice regarding nursing regulation that may contribute to unsafe practice and jeopardize the status of the nurse's license. This is important because it shows that not only is patient safety jeopardized, but also your nursing license. One pro of this solution is that nurses will be better educated on how to properly administer medications and will do all of the 5 rights and checks each time they administer a medication. One con is that nurses have busy schedules and will not want to take the time out of their very busy day to complete these classes and coursework. But at the end of the day, patient safety is of utmost importance.
A second solution that we came up with is that nurses should not be able to pull medications for a patient earlier than 2 hours before the time they are due for administration. Overrides will still be allowed for emergencies. However, each override must be documented and there must be a medical reason for the override. As you can see, it is 8:30 and Jen is currently pulling out her meds for 9 o'clock. A pro to this is that nurses will not be able to remove medications from the Pyxis early, which greatly reduces the chance of medications getting left in nurses' pockets and possibly getting dropped, misplaced, or left somewhere unattended, which greatly reduces the risk of medications getting mixed up. A con is that many nurses are set in their old ways and that it will be hard for them to change their routine. But at the end of the day, the priority is patient safety. Another con is time. However, in an article that I read, it talked about combining the electronic systems of Pyxis and Epic to work together along with humans to verify reasons for overriding medications. So when you override in the Pyxis, it automatically overrides in Epic, which would automatically save time for nurses in their documentation.
The third solution that we have is that when the nurse signs into the Pyxis, she will only be able to withdraw medications for one patient at a time. The nurse must re-sign into the Pyxis for each patient they wish to pull medications for. Andrea is demonstrating just pulling medications for one patient at a time. A pro of this solution is that it will prevent drugs for different patients being drawn at the same time and mixed up. It will also help encourage nurses to pull a patient's medication and administer them instead of pulling many medications for all patients and keeping them in their pockets all day. A con of this solution is that it will take the nurse more time to give medications and it will force them to return to the med room to get meds between each patient. In an article we read from ISMP about medication safety alerts, said that a type of at-risk behavior is pre-pouring and gathering medications ahead of time for one or more patients to speed up the drug administration process. Andrea has now returned to the med room and is withdrawing medications for her second patient. So there are a few groups of people who are affected by the issues that we talked about. Nurses are affected because they are legally responsible for administering the correct medication at the correct time to the correct patient. And they'd be most affected by changes made to the Pyxis because it would take them longer to pull medications and give them. But this adds a second or another level to patient safety, so it would be worth it to them in the end. It also affects nurse managers because they are the ones that can encourage the nurses on the floor to follow the correct medication policies. And they can also help to evaluate if changes to medication administration are effective in the workplace. And then patients are also affected because if there's a medication error that's made, they're the one who has to deal with the results of it. And they always have the right to safe medical treatment.
As the healthcare system constantly adapts to new technology, it must put policies into place and inform the employees of the best evidence-based practice of said policies to ensure safe and effective patient care.
So our final
recommendations are that nurses will participate in continuing education classes about the importance of focusing on medications for one patient at one time. Secondly, the Pyxis will remind nurses to only pull one medication within 2 hours of when they're due and only for one patient at one time. And lastly, nurse managers and other staff will encourage nurses to follow medication administration policies. And we will evaluate the effectiveness of these recommendations. After 1 year, we will evaluate statistical data about decreases in medication administration that happen because of nurses pulling meds from the Pyxis. We will also survey nurses before and after implementing these new medications and Pyxis policies. And lastly and importantly, we will ask for input from the nurses about pros and cons of the solutions because after all, we want the workplace to be happy and healthy.